So, doctor, do you have any other specific ideas or points that you would like to share with our audience related to Lyme? Because
Yes,
Lyme
yes,
is having a lot of
yeah,
controversies running around. So you're having this much experience and working with the Lyme patients,
yeah. So,
and most of our audience are Lyme patients.
so people should know that the controversy oppose highlights to the CDC and IDSA, and that I want to say very loud and clear that my point is not to say that CDC is wrong, IDSA is wrong. Is to say there are two opinions, and I think that all scientists, all people of a good faith, should voice their opinion. And when I see a patient, I always say, I'm going to give you two concessions in one. I'm going to give you the opinion of CDC. What is the standard of care? And what is ILAD's point of view? And you choose. I give you an informed, you will have an informed decision. You take a decision if you want to follow ILAD's guidelines and IDSA and CDC guidelines. The point that people should know is that doctors who are not involved in personally in Lyme have no reason to doubt the authenticity, the medical opinion of the CDC and IDSA. And it would be even not ethical to discuss medical authority. We do that because we have medical literature, and also because we have leaders, and people should know that, for example, if you go to Columbia Hospital in New York, if you go to the Department of Infectious Disease, you will have doctors that follow the CDC at the letter. If you go to the Department of Lyme of Columbia, is led by Dr. Brian Fallon, which is a teacher of ILADS. So you see, under the same roof, people disagree. You have, if you have your blood test in Virginia or in Georgia State, there is an obligation to tell you, do not trust the blood test if it's negative by law. In New York, we are allowed to treat more than 1 month Lyme disease. In New Jersey, we don't have. So this controversy divides the world. It's not that you have on one part fake doctors and good doctors. You have a controversy, and each one has its own reasons that we have all to respect. And you read, you see what you read. It would be great if we can be around a table with IDSA, CDC, and ILADS and discuss this. It is what I really wish. I don't know if it will happen one day, but I hope so. And to discuss. So what we see that the CDC tells you that the treatment of Lyme is 14 to 28 days, and you take only one antibiotic. And they tell you that the NIH studies show that giving more antibiotic do not help. I don't know how, because my both eyes saw differently, but they tell you not to give more than 1 month. And if you have more symptoms after 1 month, if you have more symptoms or if you relapse, it will tell you you have a post-treatment Lyme disease syndrome. It's like COVID. We don't really know what it is, probably immunological, inflammatory, but it's not Lyme bacteria. After 28 days, there is no more Lyme bacteria. It's gone. It's gone. And you said, if you are so knowledgeable, treat my PTLDS. So I tell you, but as I told you before, unfortunately, there is no treatment. So you tell me that I've condemned for life and you don't have treatment. Yeah, there is no treatment. We don't have always a treatment in meds. Okay, so ILADS tell you that Lyme can be chronic. There is a very important point that I would like to make. I know I hope not to take so much time, but this problem of chronicity is at the base of the controversy. And I tell you like this. I tell you that a doctor who tells the patient Lyme is not chronic is a liar. A doctor who tells you Lyme is chronic, you have chronic Lyme, because Lyme is chronic, is a liar too. Why I'm saying that? Is because if I want to know if I have Lyme, if my Lyme, I need to have a culture. Do I have a strep throat? You give me amoxicillin. I want to see, I tell you, my throat hurts. No, it's not possible to have a strep. Strep goes away with amoxicillin in 10 days, but it hurts. No. This is inflammatory. This is immunological. This is not due to a bacteria. But why don't you do strep culture?
Okay.
No. You can't. So when someone has Lyme disease, how do I know that you have a chronic Lyme? What I know is Lyme is possibly chronic. What I know is that when we infected chimpanzees and with Lyme and we gave 28 days of doxycycline and we killed them after that and we did autopsy, all of them had a live bacteria. When we do autopsy on people who had ceftriaxone, doxycycline, ciprofloxacin, we see on autopsy Lyme bacteria. So in animal model studies and in autopsies and in clinical setting, we see people who keep relapsing. So I know some people say you got the tick bite every 2 months, but they keep relapsing, or they have a persistent symptom, and some doctor dare to give 1 more month of antibiotic and it works. But no, after 3 months, no, it does not exist. So the honesty is to say, I don't know. The honesty is to say, I know that on autopsy, in certain people, it's possible Lyme is chronic. In your case, I do not know. It takes lots of strength and honesty for a doctor to say these 3 words, I do not know. Rather than, otherwise is all his assumption and deduction. And all his assumption and deduction hurt thousands of people by denying the right to be treated. One more word, if you don't mind.
Yes.
I cannot finish this podcast without speaking of Dapsone. Do I have the time?
Yes, you have. And doctor, our audience are Lyme patients, and each and everything that you share very valuable to our community.
Okay. So Dapsone Protocol. The Dapsone Protocol is in 2015, Richard Horowitz would say that you take 100 milligrams of Dapsone once a day and for 1 year. If you don't take 1 year, it's not going to work. And he said Dapsone, you have to use Dapsone with doxycycline and with hydroxychloroquine, with Distromax, with 3 antibiotics. And he did that. One day, a patient made a mistake. He took a double dose of Dapsone, 200 milligrams. And the patient got much better. And Dr. Horowitz said, maybe 100 milligrams is not really the dose. So he created the double dose Dapsone protocol. And one day, a patient made a mistake. He took double dose of a double dose. He took 400 milligrams. This patient could have been sick for 15 or 20 years. And what happened to him? He got cured in 4 days. So I repeat, he got cured in, I don't say 4 years, I say in 4 days. So instead of fainting, he understood that it's not a question of duration, the treatment of Lyme, it's a question of dose. And it's actually very understandable because holistic medicine has the weakness is not to know the right dose. In mainstream medicine, we have FDA studies, and we know that amoxicillin is 875 milligrams twice a day. And if you give 125 milligram an infant dose to a strep adult, it's not going to work. So when we treat Lyme with doses that are not effective, it does not work. So we don't dare to give too much. But here the fact is that by mistake from patient, we understood that it was all a question of dose. So Dr. Horwitz published a study, 28 patients, not the simple patient, no patient who got bitten by a tick last summer. Okay, patient who went through hell for 15, 20 years. 27 out of 28 cured. 4 days. So I got interested. I know well Dr. Horwitz, communicate very often with him. And so I started implementing Dapsone Protocol in my office.
Oh.
I have already 20 cases of Dapsone. Yes. So I remember.
How is the results, doctor, for that protocol? For the protocol, how is the results?
I don't understand.
Results. The result of
the
the
results.
protocol. Yeah.
I'm going to tell you the result. I'm going to tell you the result. I have a patient who was 17 years old who was the most obnoxious patient, disrespectful, kicked out from his school, many schools, and very, very, very bad behavior. After the protocol of Dapsone, the mother said to me, I don't know this boy, I have a new son. The father said, it's a miracle, it's a miracle. He was turning around in my office. He didn't understand. The child became so refined, so polite. Yeah. So another boy like this who was very psychiatrically affected behavior. After 2 weeks, I see him walking in the room like an adult. I shook his hand. He was only 14 years old. So much I was shocked by the change of personality. I have a patient who is well known in the neighborhood where he is because he is on a wheelchair, diagnosed Parkinson, but he has babesia. And I gave the Dapsone Protocol, and after 3 weeks, he started to get up from his wheelchair, on the wheelchair for 1 year and a half. And people on the neighborhood stopped their car of shock because he was known to be in a wheelchair for 1 year and a half. And they see now walking around the block with a pity, is true, walking. This guy who was paranoid, really severely paranoid, known in this neighborhood as the crazy guy, he came to see me and from abroad, cousin lived nearby. And I tell him, the Dapsone Protocol is 9 weeks. In no way, my wife and my kids wait for me in the Middle East. I cannot stay here. So we started to bargain. I said, listen, this protocol can be done in 2 weeks, but you take your risk, you take responsibility. He took responsibility. I heard from him 90% better. He's no longer paranoid. The psychosis is gone. How long? 2 weeks. The Dapsone Protocol is something that after 40 years of medicine, I cannot believe my eyes. I cannot believe my eyes. Just cannot believe my eyes. A patient was 20 years old. He wasn't able to come anymore to my office because he couldn't just get up from the bed. Couldn't stand up. He was so sick. He stopped his studies. Couldn't go to the university anymore. And the Dapsone Protocol, it took a lot of time, but he's doing very well now. And I told my assistant to say, if he's healed from Dapsone, I would believe in Dapsone because impossible. He was so sick, the sickest of the sickest. And so Dapsone Protocol. There was a doctor, Dr. Lambert in Tulane University in 2024, who infected mice. And she applied to the mice Horwitz protocol, the Dapsone protocol. She killed the mice. It's not nice, but she did it. And she cultured them. No trace of Lyme bacteria. And the first study, a breakthrough that showed evidence that Dapsone is able to eradicate Lyme disease. How long it takes? It takes 9 weeks. Why 9 weeks? Because we introduce slowly, progressively the Dapsone. Dapsone is found, but the treatment is really 6 days of 400 milligrams of Dapsone and 600 milligrams of methylene blue with red. So really the treatment is 6 days, but to arrive to such a dose to see if it's well tolerated, so we take 8 weeks to do it. I don't hear any complaint. I don't hear any side effect. We were so scared of the Herxheimer reaction that we bumped up all the antioxidant. We don't give 400 milligrams of glutathione. We give 2,000 milligrams of glutathione. We are so scared of Herxheimer to the point that we don't see. My secretary tells me she received no phone call actually of side effect from the Dapsone protocol. She receives more when people take doxycycline and rifampin together than with Dapsone, because we use so much of antioxidant, anti-detoxifier, that we minimize to the maximum the possibility of Dapsone protocol. If I don't speak of Dapsone protocol, that astonishes me still today. It cannot be today. It's based on my conclusion. Today, when the patient comes with Lyme, I ask the patient, what do you want? Do you want to be symptom-free or do you want bacteria-free? People say, I want to be bacteria-free, of course. I say, wait, but it comes with an invoice. Okay, being bacteria-free means 5 antibiotic protocol, Dapsone protocol. You want really that? You don't have to have that. Maybe just you want to be symptom-free, and if there is a relapse, you may think of Dapsone. If you have a second or third, maybe at the 5th relapse, you want Dapsone no matter what. But now you want maybe to be only symptom-free. And also, Dr. Ying Zhang from Johns Hopkins University tested herbs about 3 years ago, and he found a cryptolepis, Japanese nodweed and skullcap works very well, and they are able to kill also persistent cells. Methylene blue also can kill persistent cells. But we know that on petri dishes. We know in vitro. But the number of patients that became symptom-free without using 1 tablet of antibiotic, I don't have enough finger to tell you how many times. So it's definitely something playable. People who have Lyme, they need to know the opportunity, the existence of the Dapsone protocol. And they don't have to do that. I'm not telling you everybody should be on Dapsone protocol. I'm telling you that the fact is antibiotics do not cure Lyme. And this is one of the keywords. If your audience wants to hear something, when they get doxycycline, rifampin, amoxicillin, ceftriaxone, if they think that they are getting rid of Lyme, is a biggest mistake. I tell people, you take ceftriaxone IV, you take Cifromix, you take that and that. When you are symptom-free and you leave my office, take my business card. You will call me one day. So, to eradicate Lyme, you can try with herbs. You can take your chance. It's not proven. It's not because it's not proven that it's not going to happen. So this is very fair to say that you take Japanese nodweed, Chinese skullcap, cryptolepis, okay? This product that worked very well on Lyme and co-infection. You can take your chance. And if it does not work, so then you can take antibiotics. And if you want to eradicate Dapsone, it's just a question of how soft I want to be. I cannot be soft and efficient. Softness and efficiency do not rhyme. not only in Lyme, in medicine. They don't go together. If you want to have a soft, a short treatment and cheap treatment, you take a chance to have a failure.